Tele-triage 101. This is a presentation with a Creative Commons license, so you're allowed to distribute this as per the standards. This presentation has been made possible by the contribution of the following gentlemen, as you can see in this list, and I'm thankful to all of them. I am Dr. Lavanyan Doreraj, a 1974 batch alumnus of the Armed Forces Medical College. I'm a clinician and a healthcare informatician with 38 plus years of experience in healthcare informatics and telemedicine. I have, in the past, been the Deputy Director, Medical Services of the Indian Air Force, the Vice President of the Apollo Telemedicine Networking Foundation of the Apollo Hospitals Group, and the Chairman of HL7 India. I am presently the Director and CEO of Link Ambuport Private Limited, which provides the patent-pending Ambuport microambulance, clinic, telemedicine node for affordable and scalable 24/7 rural primary healthcare services. My other entity, HCIT Consultant, provides healthcare IT consultancy globally. So what is triage? Triage can be defined as a process of deciding which patients should be treated first based on degree of sickness or severity of injury. The word is basically French and means to separate out. Now triage is applied where too many serious patients from accidents, battles, epidemics, etc. come to a doctor simultaneously, thereby the need to quickly assess each patient to decide who requires immediate treatment or readmission and who can receive delayed care. So then what is teletriage? Teletriage is a triage concept applied to the field of telemedicine to quickly assess the patient's condition remotely for appropriate decision making. Today this extends to not just using the telephone but also other connectivity means and options with smartphones and so on and so forth, using things like SMS, chat, video chat, and sophisticated telemedicine applications. And this would involve sharing of audio, video, multimedia, remote tests, all of them through generally software applications or even through the phone. This is a primary step in most telemedicine interactions. So what are the outcomes of teletriage that we are looking for? The outcomes, as far as we are concerned, is to classify patients in three main categories. Number one, whether he or she is in a life-threatening situation and needs to visit a hospital immediately. Of course, before you send them, you would have to make sure that he or she gets first aid, advice and a referral. Or whether he or she can wait safely with a care plan until he or she meets the doctor physically after being given an appointment. Or whether he or she can be advised on a care plan that can be safely managed and the patient can also be safely managed locally. In other words, care plan while at home. The details are all there in the telemedicine practice guidelines. Please do go through them. Now, what are the teletriage scenarios? There are many scenarios, but let's look at some of the most common and important. A patient could contact a doctor by phone, chat, SMS or video chat, or a caregiver, that is a parent, a spouse, a relative, a friend or a professional who looks after the patient. He or she could contact the doctor by phone, chat, SMS or video. Third, a remote healthcare worker could contact the doctor by phone, chat, SMS or video chat. In such cases, generally, the remote health worker would have a telemedicine application. 2. Or finally, a hospital doctor could contact another colleague or could contact a specialist by the same thing, whether phone, chat, SMS or video chat. But in most cases, he would probably have a telemedicine application. Now, whenever such a scenario occurs, actions shall be required of both parties and we shall discuss the same. Details again are in the telemedicine practice guidelines. Now, do remember that teletriage requires certain pre and certain post teletriage actions. These shall be covered as we go along. So let's start with the first scenario. A patient calls the doctor by a simple, let's call it smart or non-smartphone. In this case, this is going to be a dumb phone. So what are the pre-teletriage actions? Please remember, these pre and post actions apply to all kinds of interactions. The doctor, as you know, uses various tools to record patient encounters. Now these could be very sophisticated tools like high-end software, or it could be things like Word or even Excel sheets, or it come down to the good old basic notebook in which he notes all the details of the patient. Well, whatever it is, he or you, in case it is you, must keep these documents or software ready. Now, we triage using an algorithm in most cases. So it is important that you keep the algorithm ready so that you can quickly work with the patient. And to help you further, keep your checklists or diagnostic protocols ready. Please remember that you must follow telemedicine etiquette meticulously. The details have already been discussed in the previous talks. The basic idea is that you must be presentable to the patient, you must speak clearly and softly, and so on and so forth. Moving ahead, now let's come down to the actual teletriage part. On picking up the call, note down the number, identify yourself, and ask the caller what his name is. And please do note down the time of the call. It is very important for you to identify yourself and also the patient. Now find out if the caller is the patient himself or is it a representative of the patient. This is important because then your actions are slightly different. And once you pick up the call, basically you could say something standard as follows. You are calling and requesting a certified medical professional for telephonic medical advice. I shall help you as best as I can. And then wait for the patient to say yes, because this then becomes informed consent. Of course, whatever you're doing, you could do in any language. There is no bar to languages on the phone. Then you ask him what his immediate problem is. If it appears that the problem is not life-threatening or very immediate, then take down various other demographic details. The details are given in the sample case sheet. Then continue with the teletriage to assess the patient. Now let's look at the teletriage workflow. But before we do that, let's understand that this triage workflow that I'm going to show to you applies to both GPs as well as specialists. Also remember that we will not discuss how to elicit clinical details, since clinical protocols for eliciting signs and symptoms leading to a provisional diagnosis are already known to you. We shall only discuss the process and expected results. So let's move ahead. The teletriage process. Now, the triage in this case, because it's a generic process we're talking about, could be with voice plus data, or audio visual plus data. Now, do remember that the patient has already been identified, the doctor has identified himself, and the patient consent has already been obtained. What are the next steps? First of all, do you know the patient? Well, if you do not know the patient, the case is obviously a new case. But yes, if you know the patient, then in that case, the patient could be an old case or a follow-up case, as you call it, or he could have come with some other problem which makes him a new case. Well, irrespective of whether it's an old case or a new case, please assess the patient with the available data that comes to you, and if you feel that the patient is an emergency, then immediately advise him for some basic relief measures and guide him as to how to reach the closest healthcare system, the closest hospital, or the closest doctor where he can get care. Now, if the patient is not an emergency and it's a routine case, you need to assess and see whether the case is fit for a telemedicine consult. This is very important. You must not try and get a case which needs to be seen by you face to face to be given telemedicine advice. So you need to assess this. Once you've assessed, the case could either not be fit for telemedicine consultation, in which case you simply give him some health education and refer him or her for an in-person consultation either to you or to the nearest doctor. If the patient can be seen via a telemedicine consultation, then this is what you need to do. First of all, if you're a GP and you feel it's a specialist case, then please refer the patient to a specialist. On the other hand, if you are a specialist and you feel that it's a routine GP case, do not see him. Instead, advise him to be seen by a GP. Then, if it actually is a new case that is fit for telemedicine consultation, this is what you do. This case is where you do not have video conferencing, you're just using voice. In such a case, what you do is you give him health education, counseling, and medicines from the O group. Now, what is the O group? You've already been explained what it is. It is also given in the telemedicine practice guidelines. Please do go through the guidelines. You can clearly see all the drugs that can be prescribed to this patient. Now, if you do have video conferencing, you can in addition give medicines also from the A group. Alright, so what if the case is an old case? Well, in such a case, whether you have VC or not, if it's mostly for refills, then health education counseling as usual needs to be done, and you can give medicines from the O and the A group. And also, if you wish to optimize the medications, you can add medicines from the B group too. So that, in short, are the three separations that you do, or the triage you do, of a patient who comes to you via a telemedicine consult. Now, this, as you know, this document, Telemedicine Practice Guidelines, is a living document, and as people ask for certain changes in the medications or so on and so forth, the changes are made if found fit. Like, for example, additional medicines for psychiatrists to prescribe have been added to this list. Now, let's come down to post-teletriage actions. Do remember, it is very important for you to check that you have documented properly, especially when it comes to patient consent, his identifications, his contact details, clinical and care details. And do not forget his diagnosis or provisional diagnosis, and do preserve this documentation. In case the patient you've seen happens to be one who has some kind of a disease which has to be notified, then do contact the authorities for these cases and do share details to ensure that they are followed up by the local health worker. Now, if the patient has been advised emergency evacuation or hospital admission, then try where possible to coordinate with the local hospital. Please ensure that you try and coordinate for the ambulance to be dispatched to the right person and address, and do share the patient's clinical details with the doctor either by software, or if you have nothing, just make a call and share all the information. Now let's look at teletriage, that is done when a patient calls a doctor by SMS, or the famous missed call. Well, it's pretty similar. On receiving the SMS, just note down the time it's been received and the number, then call up the patient or the person who's called you, and the rest is the same as a telephonic consult. On the other hand, now if the patient calls the doctor via chat, then it's a little richer as far as the interaction is concerned. What you do is, on receiving the chat, note the time, the number, and then call the person. Now, after you call the person, the rest is the same as a telephonic consult and triage. The good thing out here is, as you can see in these pictures, the patient can actually share documents and tests on chat to help you with the diagnosis. Now, if the patient actually is able to manage a video chat with the doctor, then the process is a little different. Remember what I told you about etiquette? Yes, the doctor has to be well dressed and presentable. And he should also ensure that the surroundings are appropriate. Only then should we accept the video chat. And once you receive the chat, then you note down the time received, and the rest is almost the same, but you have certain advantages that you can see the patient's face. Of course, in this case, the patient's face has been anonymized, as you can see. We can't share patient details, and then you can actually see the patient's respiratory rate. You can see his faces, which makes you decide on which direction to go in with respect to the diagnosis. Also, the patient can share documents and tests on chat to help with the diagnosis. Like I said, the rest is the same as a telephonic consult and triage. Now let's look at scenario 2, where a caregiver or a guardian calls a doctor. Now this triage is similar to the patient's called Tele-triage. The only difference here is that it's important to take down the details of the caregiver along with that of the patient and record both, because you have to get in touch with the caregiver, and you have to also ensure that the caregiver gets you the appropriate permissions, that is the consent from the patient, or gives the consent on the patient's behalf. The rest is similar to patient Tele-triage. Now let's look at scenario 3. This is a little different because it is now a health worker who is calling a doctor. Here the patient, remember, is first seen by a local health worker. It's important for you to take down details of the health worker when he calls you or connects with you, and of course of the patient. Why? Because you could have multiple health workers calling you from different areas, and you do not wish to get confused by who is called you about what patient. Now the details that you would collect are as follows. Try to get his employee ID also, if such a thing exists. Now do understand these interactions are much richer, since vitals can be collected along with various test results. Also remember that there is a certain component of touch and feel out here, because a local medical person, the health worker that is there, can carry out the doctor's activities as guided by him, and he can even carry out very sophisticated activities like ultrasound, echocardiography, and so on and so forth. Of course, ECG is very routine, but these complex tests can also be carried out when he interacts with a specialist. Of course, he would have to have sophisticated software tools. Do remember that government rules or state rules apply, because he cannot do these sophisticated tests unless he is being authorized by the local government. The rest is similar to Tele-triage. And then we come down to the last scenario, scenario 4, when a doctor calls a specialist or he calls one of his own colleagues. Now this is basically used to contact a specialist or a colleague for a patient who's in an ER or a ward or an ICU or even possibly in a PHC. Now remember one thing, both you, the doctor who's calling the specialist, and the specialist are extremely busy people. You cannot afford to waste time. In other words, before you start, keep the patient's age, gender, comorbidities, hospital details, if he's in a hospital, vitals, lab tests, all the information that you wish to pass on to the specialist so that he can answer your question. And also keep your specific question ready. Only then go in for the call or video call or working through the telemedicine software. Remember, the call, if it is a call, has to be kept short, crisp and clear, and you have to be clear about the answer that is required. And please remember, do not waste time. Call up the specialist, identify yourself and state the question like, please advise with respect to patient Mr. ABC, whose findings are as follows, blah blah blah, and I need to know, say, the line of treatment, or say, should I change this drug, or say, should I transfer, and so on and so forth. Now, do remember that software use makes this extremely easy and standardized, but then you can also work on a paper document and you can even work through the phone, so there is no issue with that. But whatever it is, please remember, do document and preserve. That is the right way to go. Now let's look at the case sheet. It's a very standard case sheet. This is the first part of the case sheet which has demographics in it. Remember, this is as per the telemedicine practice guidelines which you must follow. These minimum pieces of information have to be there. You can add extra information if you so desire. Like, for example, I have added this extra box for the caregiver details. I have added this extra information for the patient's phone, and you can create a unique ID for that consultation if you so desire. But this is the way it should go. This is the minimum information you must have. And then coming down to the clinical part, it's a very standard clinical part. It's been discussed previously also. The chief complaints, relevant points from history, the lab findings, suggested investigations. Do not forget the diagnosis and provisional diagnosis. And of course, you must write down the e-prescription. And again, another very important thing, do not forget your signature. That's important, because it becomes illegal if you do not have your signature on your prescription. So this is all mandated by the Telemedicine Practice Guidelines. Please do read up. Now let's start looking at Tele-triage with a focus on COVID-19, which is a pandemic that we are all in, rather the whole globe is in right now. How do you Tele-triage a patient who could be a suspected case of COVID-19? You start with a very simple process. Let's first understand something about COVID-19. The COVID-19 pandemic, as you know, is sweeping the globe, and India has immediately taken action to monitor, control, and treat this highly contagious viral disease. The Disaster Management Act of 2005 and the Epidemic Diseases Act of 1896 have been activated. Now, every doctor has to notify the local control rooms at district level of any suspected or confirmed case of COVID-19, as it is a notified disease under the Act. For advice, please go down to this URL. Don't worry, I'm going to give you a copy of this presentation. The URL is given in the end of this page, and you will also find it with some of the other websites. But please do go through this. It has the telephone numbers and contact details and so on and so forth. Now let's look at how we start. We obviously need a checklist. I'm going to give you a sample checklist. You can use this. A copy is also available to you. Now it's a big checklist, but it makes your work easy because you can quickly go through it. Of course, you start with the standard greetings. I am Dr. So-and-so and working at so-and-so center. And you must say the standard things like you're calling and requesting a certified medical professional, blah, 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 and wait for him to give you his consent. And then make sure that you can get the telephone number and his name, and then ask him for his immediate problem. If you think it's not an emergency, then you can go down, to the next part, which is where you ask for the address and so on and so forth. Don't forget the PIN code, because a lot of coding and statistical analysis are done using the PIN code. Then you start with the actual COVID-19 protocols. You start by asking about the fever, cough, diabetes, and hypertension if they have, and so on and so forth. An important part to ask for is does he have any difficulty in breathing? So how do you check, suppose you're on the phone, to find out whether he has difficulty in breathing? Yes, you could hear him panting, but a simple method is ask him to take a deep breath and count till 30 without inhaling again. Now when he does that, keep listening. If he can take it to 20 or 25 is okay. But if he's not able to even cross 10, then this gentleman or this lady has to be quickly taken to the hospital probably. And of course, if the patient's condition is suddenly worsening in the last 48 hours, yes, it is something you have to keep in mind. So you go through this whole list, but what is important is that you need to have your triage protocol with you, which we shall look at now. This is a very nice triage protocol document, a chart. It's especially for GPs, and as you can see, it has nice color coded information, so that if everything is green, you feel yes, the patient is safe, and so on and so forth. If it's got some browns, perhaps you can treat the patient at home, and if it's got a little bit of reds, you might have to transfer. If it's got too much of reds, you have to transfer. So essentially you tele-triage to either observe at home, treat at home, or transfer to hospital or emergency transfer. Please notice, whatever you do, the patient has to follow all COVID-19 precautions, including isolation. Now, this is a living chart, of course, so it keeps changing. These days, because of the lockdown, the travel history is of less importance, but the moment the lockdown is taken off, the travel history might become important again. Also remember, things like loss of taste and smell has become important nowadays, and other things like obesity or even things like being overweight has been shown to be something which has a bad prognosis with respect to COVID-19. So please keep that in mind. Now, this is just another chart which tells you how to use the checklist. So, the triage list. So please go and have a look at it. Now, I have another interesting chart for you which can help you compare the common conditions like common cold, flu, and allergies vis-a-vis COVID-19. Please take time to go through this. It's a very useful chart which will help you. Now, do remember that when you're speaking with a health worker, you have a certain responsibility towards the health worker, and you need to educate him on how to carry out certain activities, especially with this COVID pandemic. So let's see what you're supposed to tell the health workers and advise them to follow. All patients reporting should be received and examined as per COVID-19 protocols. In simple word, please keep in mind that any patient who comes to you, you must think he is COVID positive till proven otherwise. Now, patients should be seated or standing 6 feet apart. Outside seating is better because the breeze blowing outside could blow away any COVID-19 virus if there is some in the air. And patients should be made to wash their hands with liquid soap, sanitizers on arrival. Going back to the previous point, do remember that seating a patient in a closed room or in an air-conditioned room is a no-no. Please don't do that. Even if you are so-called lucky to have an air-conditioned room, please open the windows, switch off the air conditioning, let the breeze blow. Give the patients a mask to wear wherever possible, or the moment the patient walks in, tell him that he must cover his mouth and nose with a cloth, hanky, or a pallu. No interaction should take place between patients, because patients tend to have this thing about chatting with each other. It should not happen, because now we know that even speaking to one another can transmit the COVID-19 virus. The health worker, of course, should have his PPE on. He should wear a mask, gloves, eye protectors, and a gown. His physical contact with the patient should be kept to a minimum, and he should see only one patient at a time. In other words, no crowding of patients around the doctor, which is a common thing that we tend to see in small clinics and PHCs and small hospitals. So please be careful. A telemedicine consent form is a mandatory requirement, but please ensure that it is not contaminated. The guy who uses his pen or he holds the paper, he shouldn't contaminate it. Please take necessary action for that. And if there's a worst case scenario where you're unable to take a consent, please take a picture of the patient with a thumbs up like this, so that you can say, yes, the patient gave his thumbs up, he's willing for a consult. All equipment should be sterilized as per standard protocols after each use. Disposables to be disposed of as per biohazard protocols that are in vogue. Please see the reference section and also below. So, moving ahead, we've come to the end of our presentation. We have given you a rich list of references and suggested readings. There are 2 pages. Please do go through these pages, because these are important for you. Let's look at the second page. As you can see out here, this is where is it? Yes, here it is. The telemedicine triage video is a very interesting video to watch. It shows you how you can do a tele-triage. Moving ahead, all these documents are important for you because I have the checklist is here, then the tele-triage, this presentation itself is right here. And so yes, it's important for you to keep these documents with you. We are trying to put it in other places, in other URLs, in other websites also where possible. So thank you for having found time to attend this presentation. Well, if you have any questions, I'm sure you might have many. Please do first check out our FAQs because most questions are answered there. These FAQs are available at this URL as you can see out here. And then if you still have certain questions, then please do attend our live Q&A sessions, which will be happening from time to time. Be in touch with us. Thank you. This is Dr. Lavanyendra Raj signing out.